Bronchoscope foreign body set. We have 3 sizes of bronchoscopes. We have size 8.5, 7.5, and 6.5. Okay, so essentially how to assemble the ventilating bronchoscope. First, we have 3 openings. This is for the ventilation, so that would be for the anesthetist to attach the airway. And this is for the flexible suctioning, and this would be our main working area. First of all, there would be a very small notch there, so everything should be pointing up. Whenever we're assembling the bronchoscope, everything should be pointing up. There's a very small notch. You will find it in all 3 bronchoscopes. The first thing that needs to be fitted would be the light source, and again, always remember everything pointing up. You will have to put your light source in essentially in the groove, okay, so it all slides in nicely and then locks, so everything still pointing upwards. This is necessary even if you don't want to attach your light lead here, because otherwise you would not be able to attach the rest of your instruments. Then next would be, essentially, we have a guide for the optical forceps. It's like a sheath that goes inside to protect the optical forceps, and again, everything points up, so everything still points up, so it locks, okay, and then you put your optical lens, okay, again, easy, everything is pointing up, everything is pointing up. So for the time being, it's unlocked, so it's not pointing up, it's pointing horizontally, but for everything to lock, you just have to point it up. So now, everything is locked from this end, okay? Still, you can remove everything from this kind of area when you need to switch to the fiber optic forceps, but everything is locked from this area. If you need to unlock it and remove your lens, you just kind of put this on a lateral position and it slides, okay? Now if we need to switch to the forceps, to the optical forceps, what we need to do is first that we need to unlock the lens, because we need it to go into the light forceps. So we have our lens, so that's essentially all still connected to essentially ventilating the patient. Essentially plug it with their finger whilst you're setting up the ventilating the optical forceps. So to set up the optical forceps, again, everything is still pointing up, so it goes like this, and then to lock it again, you just have to go up, so it's still now locked. So now it's part of the optical forceps, okay? And for the ventilating bronchoscope to fit everything together, we have to remove everything along with the light carrier that we had, okay? And now the surgeon can plug the airway for ventilation whilst we are setting up. You will find that with a size 8.5, it's easy to fit your forceps in any direction, but you will find that with the smaller scopes that essentially you might get stuck. If you go into a vertical direction, you would not be able to fit it directly in, but if you go in a little bit of a lateral position, you will find that it still goes inside. So even with a small bronchoscopes, you can still fit your forceps in, but you just have to introduce it in a lateral oblique position, so it fits in, it slides in and out. Maybe putting some saline on the rod may help you kind of introducing it a little bit sleekly. If you do that, and essentially for your bit, essentially for the suction area, we have different gadgets here. So we have a cannula introducing bit, which we can use for cannulas or injection. Just you need to make sure that the 0 meets the 0 here, so it kind of clicks 0 on 0, so that essentially whenever you put a cannula for injection, it does not get blocked. That is for cannula introduction. Other things that you can use is this adapter, which is a nicer adapter, especially if you don't really need to do any injection. It helps with suctioning if you have a spaghetti suction on the side. Also 0 on 0 it clicks, and then not to lose any air you can also put this rubber blockage adapter here. Okay, so that would be for the side part. You can use the ventilating bronchoscope with the light source. As we explained, there's a groove inside there that your light source needs to go into. Yeah, it needs to slide into that groove, and everything, as we explained, needs to click in a vertical direction. And still use this 3-window adapter. You can close the main working area with that, and you can switch between either a glass window, where essentially you're sealing the airway so there's no loss, and then you can switch into an open working area, which you can essentially use and introduce your forceps inside and retrieve a foreign body. It would not be typical to use that. For our optical forceps, if the lumen gets some tissue inside and essentially we need to clean the lens or the pathway where the lens runs, or if we need to do some flushing, there is a cleaning adapter that can be attached to the forceps. Essentially it goes in this direction. This needs to be open, this goes in this direction, and again, as usual, we have to lock it in this direction, and then we can use it afterwards for flushing. So it's just once it's locked, so it essentially doesn't come out, we can put a syringe and flush just essentially this area if we need to clean this area. For the optical forceps options in the foreign body kit, we have 3 forcepses. The first one, this is a peanut forceps. The second one would be the alligator forceps. The third one would be the stent forceps. It's more serrated, which can grab stents more efficiently. For one more thing, on our set, we don't have a sheath to protect the lens. So what we're gonna do is that we're gonna use one of the plugs, yeah, just to protect the end of the lens, so it would not be bashing against the tray when it's being sterilized.